Vaccines are the main weapons in the fights now against COVID. And in Ontario, pharmacies are a key component of that rollout. The province began to ship AstraZeneca doses to local drugstores a month ago. But a CBC News investigation reveals that plan is leaving some neighbourhoods hardest hit by the pandemic, with only limited access to the vaccine. This morning with us, Valérie Ouellette, who is CBC's senior data journalist in Toronto. She has been looking at the map and the numbers and has the details on how this disparity is playing out. Valérie, good morning.
Good morning. So, Heather, we compared the list of all 1,400 vaccinating pharmacies from the Government of Ontario up to date with the location of all retail pharmacies in the province, with a specific focus on Ontario. And then we compared infection rates in the past month. And we found several trends, but the most important trend is in Toronto, where several communities have been asking for more COVID vaccines in hard-hit neighborhoods, particularly in the northwest of the city. And what was the most interesting trend is that when we looked at the neighborhoods with the highest infection rates in the past month, roughly 1 out of every 5 retail pharmacies offers the shot. But when we looked specifically neighborhood by neighborhood, we found that at least 2 neighborhoods that are in those hard-hit communities don't have access to any pharmacy giving out the vaccine. You can see the map that we created here showing exactly what I'm talking about. So you can see that in places like Black Creek and Weston, there are options, but in the neighborhoods of Humbermead and Maple Leaf, there are simply no retail pharmacies that are offering the vaccine. We called them up to ask what was the reason. A lot of them told us that they were too small, and others told us that they didn't comply with one of the criteria to enroll in this vaccination program, which is that they have to have participated in last year's influenza vaccination campaign. So there definitely are still barriers, challenges for these communities to get the shots that they so desperately need. We showed these results to a community leader. Here's what he had to say.
A working class community. A lot of folks, most folks here work in service sector, construction, those things that people can't do from home. And now, in recent weeks, again, we've seen, it's been verified, the things that we've already seen on the ground, that people can't access vaccines because there's no pharmacies here or few pharmacies here that are providing it.
So he also added that pharmacists play a key role in access to healthcare in these communities, mostly because some residents don't have English as a first language, so they can provide some translation services sometimes and help them really better understand what are the risks that are related to this vaccination campaign and the various vaccines that are offered. So really an important role and an important place where people are already heading to for information.
So you mentioned, Valérie, that it is in Toronto that we see the trend most clearly. But what about the rest of Ontario? Do the same disparities exist?
So we found some disparities. The 700 new locations that have been announced by the province this week that will start taking appointments very soon correct or alleviate some of these disparities, but it was still quite shocking to see 1 month into this vaccination rollout what the discrepancies are. And I want to show you, we mapped out some of the most striking ones. So you can see here that in GTA communities that have been really hard hit by the third wave, in Mississauga, in Brampton, and even in Ottawa, who has been, struggling with the third wave in a significant way, the percentage of all pharmacies who offer the vaccine is significantly lower than in Kingston, for example, where COVID rates have been quite low. More than half of pharmacies in Kingston offer the shot. Now, we have to be fair and highlight that there are mass immunization clinics, and there will soon be mobile clinics, we're told, helping out in hardest hit areas in Toronto and perhaps in other hardest hit communities across the province. But pharmacists wanted to highlight in every one of our conversations that, they are an accessible option. They are very often more approachable, and that they should have the shot, especially where it's needed right now.
Valérie, thank you very much. That is Valérie Ouellette from Toronto this morning. And